Now, I was surprised to read that, and we'll obviously cover this as we dive in, but this is, I thought I read, the fastest growing cancer these days out of the blue, and I don't know why that is, but the topic on this episode that we're going to be recording is thyroid cancer. So, Dr. Tom, what is thyroid cancer?
So thyroid cancer is cancer that starts in the thyroid gland, and basically it's thyroid cells that get a mutation and just start to grow out of control. The reason why it's rather serious is that the thyroid gland makes all kinds of hormones that regulate your metabolism, your heart rate, your blood pressure, and your body temperature. So cancer here, if it's not treated, quickly and decisively, can lead to, lots of problems long term.
And I think it's obvious, but we're going to ask, some of these questions. There's no such thing as a dumb question. You learn that in grade school. And so in this thyroid cancer episode of Ask Dr. Tom, the next question is, where does thyroid cancer start?
Yeah, so if we look at the anatomy of the thyroid gland, for men, you can kind of feel like the bump in your throat, which is a thyroid cartilage, or sometimes it's called an Adam's apple. And so slightly below that, it's kind of like this butterfly-shaped gland, which is a thyroid gland. You can't really feel it because it's a little bit deeper than you could usually feel. And within that sort of thyroid gland, there's two main types of cells. One of the main types is follicular cells, and these cells use iodine from the blood to make thyroid hormones. So basically, if they make too much thyroid, you have hyperthyroidism. If they make too little thyroid, you have hypothyroidism. The thyroid hormones, as I mentioned earlier, they regulate things like your metabolism, your heart rate, your blood pressure, your body temperature. So if you have too much or too little, then you're either running too hot or too cold, or you're feeling hyper, or you're feeling sluggish. The other type of cells that are in there are called C cells, sometimes referred to as parafollicular cells. And those cells make a different hormone called calcitonin, which basically controls how the body uses calcium. Now, those are two main types. There's some minor types, like there's some immune system cells and some supportive cells called stromal cells. But because they're smaller amounts, you don't usually talk too much about those. And the reason why it kind of matters is that the different cells, when they become cancerous, there's different sort of types of cancers that grow, and those cancers could spread at different rates and require slightly different treatment methods.
Yeah, one of the things that you mentioned, we're talking about thyroid cancer with Dr. Tom. So you mentioned the Adam's apple. That is part of the thyroid?
No, it's the cartilage that you feel pushing out.
Yeah.
Is the what you feel like right over in here is this part of that is what you're feeling is some of the thyroid cartilage is on the outside.
Huh. Interesting.
Yeah.
So are there different types of thyroid cancer?
Yeah, there are. So the main types of the thyroid cancer is what they call differentiated, which includes papillary, follicular, and Hurley cell type of cancers. You also have medullary, and you also have differentiated thyroid cancers such as, So you have the differentiated cancer, which includes things like papillary, follicular, and the Hurley cell. And so papillary cancers sometimes are called papillary adenocarcinomas. And so in terms of how often do these occur, about 8 out of 10 thyroid cancers are referred to as papillary cancers. These types of cancers tend to grow slowly and usually develop in only one lobe of the thyroid gland. Even though they do grow slowly, though, they could still spread. So if not, caught and treated, they could eventually spread to the lymph nodes in the neck, and then once they get into the lymph system, they could spread anywhere there's lymphatic circulation. They can be treated successfully, and rarely is this type of cancer fatal. There are subtypes of papillary cancers, but if someone wanted, more details on that, it'd just be better if they contacted us and we'd look at some of the, their workup and their medical record to address that stuff. The other type of differentiated cancer is called a follicular cancer, and is sometimes referred to as a follicular adenocarcinoma. And I would say 1 out of 10 thyroid cancers would be a follicular type. It's more common in countries where people don't get enough iodine in their diet. This type of cancer does not usually spread to lymph nodes, but they can spread to other parts of the body, such as the lungs or the bones. The outlook for a follicular cancer is not as good, but it's still very good treatment options for it. So in other words, even though the papillary cancer would be easier to treat, this one is still not so bad. And then the next one is the Hurley cell cancer. Sometimes is referred to as an oxyphil cell carcinoma. About 3% of thyroid cancers are this type. It's a lot harder to find and a lot harder to treat. Outside of, let's say, those are the differentiated cancers, now you have another category is the medullary thyroid cancer, which is about 4% of thyroid cancers. It's basically a cancer that develops from the C cells of the thyroid gland, which are the cells that make the calcitonin. The medullary thyroid cancer is much more difficult to find and treat. It's broken down into different subtypes, and the different subtypes, some of it is inherited and some of it is not inherited. There's also an anaplastic thyroid cancer, which is a more rare form of thyroid cancer. It's thought sometimes it may develop from an existing papillary or follicular cancer, but it's referred to as an undifferentiated cancer because the cancer cells do not look very much like normal thyroid cancer cells. This cancer could spread quickly into the neck and other parts of the body, and is very hard to treat. So in terms of so far which one of these thyroid cancers is the worst, it would be the anaplastic thyroid cancer because it spreads the fastest and it's the most difficult to treat. There are less common thyroid cancers, so by no means is this list comprehensive, because there's always very rare cancers that, we've seen cancers that are so rare, there's only 30 reported in history of planet Earth. So anytime there's something that's that rare, there's nothing to find. There's not been enough people with that cancer where there would be enough data collected to know what to do. There's also behind, but attached to the thyroid gland, there's 4 tiny glands referred to as parathyroids. And the parathyroid glands help regulate calcium levels. And while parathyroid cancers are rare, it's still possible. But the data says there's less than 100 cases per year in the United States. So it's kind of like an overview of the different forms of thyroid cancer. One of the things I'll just kind of share is that no matter what type of thyroid cancer you have, the process for getting from where you are to where you want to be, which ideally is, healthy, no evidence of disease, you never see cancer again in your body, that kind of state, it's pretty much the same in that you got to see a competent professional, someone's got to do a thorough workup, and then you got to look at all your treatment options, and then you got to pick the treatment options that provide the best return, meaning highest success with a reasonable to very low level of risk. And that's basically the game plan. So you find out your facts first, and then you decide the treatment. You don't decide the treatment before you know what you're dealing with.
This is the Ask Dr. Tom show with Dr. Thomas Incledon. He's the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. And if you or someone you love has been diagnosed, it seems like the chances, and I know Dr. Tom's going to expand on this, the chances are higher if you're a woman, if females have a higher instance of thyroid cancer. But the big takeaway from what Dr. Tom just laid out is 8 out of 10 of the thyroid cancers are what they end up telling you. Like, there's no such thing as good cancer, but they will say, this is a good cancer to have because it's highly treatable and it's pretty... not easy. None of it's ever easy, but it's pretty simple to get it and get you out of the woods on it as long as you catch it early. But if you need to do that and you're looking for some help doing that, for yourself or somebody in your family, go to causenta.com, causenta.com. Fill out the form in the middle of the page to set up your free call, or dial directly 480-883-7240. I'll give you that number one more time, 480-883-7240. So with regard to thyroid cancer, what are some of the stats that that people might like to know from who's having it, up to date lately as of 2019?
So these are the 2019 American Cancer Society estimates for thyroid cancer in the United States. So about 52,070 new cases of thyroid cancer estimated this year. Of that 52,000 plus cases, 14,260 they expect to occur in men, 37,810 in women. So significantly more women will have thyroid cancer than men. Now, keep in mind, these are new cases. What they don't tell you in the data is how many current cases, But if you did some math, what it appears is that you have all these new cases, and then you see that there's 2,170 deaths from thyroid cancer. So not many people are dying. What is interesting is the death rates in men and women are predicted. So 1,020 men will die from thyroid cancer, 2019. 1,150 women will die from thyroid cancer. So despite women having, almost 3 times the incidence of thyroid cancer, death rates are about the same. They're saying that the death rate from thyroid cancer has increased slightly in recent years, but it still remains very low when compared to other cancers. So what kind of stood out for me when I was looking at some of this is that why, despite women having 3 times the incidence of thyroid cancer, why are the death rates almost the same as men in terms of actual numbers? And I can't help but my personal experience is just looking at most guys just take too long to do anything. There's always exceptions. Like I had a gentleman that just came in with a very rare skin cancer. And he's been dealing with it for 3 years. And he's like, I'm tired of playing around. I want to beat this thing. So he's been to all these centers. And he came in one day and he said, all right, let's just move forward and take action now because I'm tired of this dragging on anymore. Normally, that's what I see women doing. They're like, I've been dealing with this and I want to get this resolved. Whereas typically men will say, well, I'm okay. I don't feel pain yet. So they're justifying the reason to hold off on doing anything or taking action. And what they should be doing is reframing it like, I got to make sure I live because I have a wife that loves me and I have kids that love me, and I got to make sure I'm coming home to them tomorrow. So just got to reframe how they're approaching things.
This is the thyroid cancer episode of Ask Dr. Tom, and we're focused on, as Dr. Tom explained, it's a little butterfly shaped gland that is typically like below your Adam's apple, and we're talking about thyroid cancer. So what are some of the risk factors for thyroid cancer?
So there's kind of a decent list. So I'm just going to summarize some of these things here. So first, as far as risk factors that cannot be changed, gender, age. So it's 3 times more likely in women than men, we talked about. As far as age, it's more likely to in women to occur in their 40s or 50s, but in men it's more likely to be in their 60s or 70s. There's hereditary conditions. There's different types of thyroid cancer we talked about earlier. Some of them are hereditary. Under one of the forms of medullary thyroid cancer, about 2 out of 10 medullary thyroid cancers are a result of inheriting an abnormal gene. So there could be, this is where again, like when a couple is looking to have a child and they do all the genetic testing to see what genes they have, this would be like some of the information that they may want to find out. So do either one of us has a risk for cancer that we could pass on to our child? Let's see. Outside of that, so there's definitely some different genetic predispositions, meaning, genetics that you could get from your mother or father. Other risk factors would be like if you've known that your mother had it, your grandmother had it, chances are that it's running in family history. Even without a genetic test, you may assume that there's something going on that's increasing the likelihood I may have it. Now, as far as risk factors that may be changed, one is iodine in the diet. And so we mentioned earlier that follicular thyroid cancers are more common in areas of the world where people's diets are low in iodine. However, if your iodine is too high in the diet, it could increase the risk for papillary thyroid cancer. So what you want to do is have enough iodine, but not too little and not too much. And then that's just, look for foods that contain iodine and make sure you're not pigging out on too many of the high iodine foods. Another risk factor that can be controlled is radiation exposure. In some cases, you don't have an option. So, for example, children that sometimes have cancer and they're being treated with radiation in order to kill the cancer, that radiation may predispose them to getting some other type of cancer later on in their life. Adults do not seem to have the same type of risk. So, generally speaking, if a body is exposed to radiation, it seems to be more harmful for children than for adults. Let's see, outside of that, I would say that getting normal workups and making sure there's no lumps that get ignored. So a lot of times if people could feel a bump or feel something swelling in their neck, that's an indication there's something going on. It may not necessarily be cancer, but it may require some other medical attention. So just get it looked at. That way you don't have to find out later on when you're tired that, oh, wait, I had cancer that I could have addressed previously.
We're talking with Dr. Tom. This is the Ask Dr. Tom show, and today's topic is thyroid cancer. When you Google thyroid, and in fact, more and more, I've heard from people, just like everyday people, talking about these thyroid diseases they have. And I've heard hyperthyroid, hypothyroid, and Hashimoto's. Do those play into thyroid cancer? Because it seems like I'd never heard of those things before. And then I've heard from, like, just being out at, like, the grocery store, the barbershop, people talking about having those, and more than one person. So do people that have those conditions need to be concerned with an incidence of thyroid cancer, or is it kind of like apples and oranges?
It's kind of like apples and oranges, but there's a couple of things, though, that it seems like there's a lot more awareness of different diseases today than ever before. One is that we have the ability to share information globally in milliseconds now. There was a time when, there could be a war in Europe and we wouldn't find out about it for years. And now we're finding out about it in 2 minutes or less. You got like a whole camera crew that's using satellite to get information beamed everywhere. So, and then with the technologies, with cell phone and stuff like that. So there's greater awareness of almost everything simply because we have better communication and better distribution of information now than ever before in history. But if we let's say, push that aside, we also have better diagnostic capabilities today than ever before in history. So even something as simple as an ultrasound, more people can get an ultrasound of their thyroid today than ever before in history. So as a result, doctors are more likely to find thyroid issues. So you kind of have, like, some of this is just the benefits of technology. Like, we can share information, we can uncover problems faster than ever. But now let's look at some of the other aspects. At one point, the number one prescribed drug in the world was Thyroid, and approximately 80% of that drug was prescribed in the United States. The United States has roughly 4% of the world population, but we're consuming 20 times greater amount of thyroid than any other country in the world. And as a general rule, most people in the United States have no problem with iodine. I'm not saying everyone is normal with iodine status, but generally speaking, the food supply here provides enough iodine. So it raises all these concerns or questions like, one, why is this country taking so much thyroid medication, and what's driving that? And, this is where you start looking at changes in in a microbiome of the mouth and the digestive tract, and how does that relate to impact the thyroid gland function? From a numbers perspective, I mentioned earlier that the thyroid gland has very few immune cells. But one of the limitations with medicine is that, like in a hormone, it could be very powerful, but it could be present at 1 part per trillion in the body. So at a very, very tiny amount in your blood, it could still have a very big effect. So we look at things like, testosterone and estrogen, primary sex hormones in men or women, and they're pretty powerful at small levels. There's a lot of the information medicine is based off the fact, well, if something's low, it doesn't have significant physiological impact. But we already know that's wrong. For example, would be, let's say you're allergic to bees. A tiny 1 drop of bee venom could kill you. You don't need a lot. Just need a tiny amount, and that induces a whole chain reaction in your immune system. So it might be something as simple as the small amount of immune cells that we didn't pay attention to all these years in the thyroid gland. Maybe there's some minor change there, and it has big impact on how the rest of the body sees the thyroid gland. And that's why we're seeing all these people diagnosed with hypothyroidism and Hashimoto's and stuff like that. So there's definitely a lot more going on with the thyroid gland than ever in history. How much of that is awareness versus, changing in the environment and so forth, it's somewhat debatable right now.
He's Dr. Tom. This is the Ask Dr. Tom show. Dr. Thomas Incledon is the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. And we talk about health. And today we're talking about thyroid cancer. Can thyroid cancer be found early? We talk a lot about early detection in these other areas. Is it possible to get early detection and nip this in the bud?
Absolutely. One, you'd look for signs and symptoms of, anything that might seem like it's unusual, let's say. So some examples would be a lump in the neck, maybe you're feeling it growing quickly, any swelling in the neck. Maybe you don't feel a lump, but you just notice one side is just, puffier than the other side. Maybe pain in the front of the neck, sometimes going up to the ears. Hoarseness or other changes that do not go away, trouble swallowing, trouble breathing, a constant cough that is not due to a cold. If you have any of these symptoms, you want to definitely talk to a doctor right away. What I tend to see is people just search for stuff on the internet. And one of the dangers of that is when you search for stuff based on what you have, you're going to think you have everything under the sun. So you're going to have, all these different diseases. And most of the time, it's just it's not how it goes. So it's rare that you could diagnose yourself just from a Google search or something. So that's why you want to see a doctor that's competent and can help you get the right treatment and go down the right path to get better.
So how is thyroid cancer diagnosed then?
Basic model, physical exam through a competent doctor. They may follow up with a thyroid scan or some other imaging test. That could be like an ultrasound, an MRI. At some point, they may get blood tests, may do a biopsy, may follow up with some genetic testing to see, like from the biopsy, what's going on. And then send it out to a pathology lab, and the pathology lab sends you back a report saying, here's what we found. And that's kind of how you sort of know what's there. And if the doctor suspects it's spread further, like say outside the thyroid area, they may do like a PET scan or something else that sort of takes into a larger area of the body just to see where it's spread. But normally if you feel a bump and you take action right away, it's going to be local. It's unlikely that it's going to have spread everywhere unless you just ignored it for a long time.
How about how is it treated? How is thyroid cancer normally treated then if you discover that there's get it early, or maybe it sounds like even if you don't get it early, it's kind of slow. So getting it even a little bit late can still feel like early. So what do they typically do to treat it?
So the way it kind of works is like the medical algorithm, or the way doctors make their decision making, if you will, is remember we talked about the different types of cancers, and there's different types of thyroid cancer and different types of staging. So basically, based on a pathology report, you're going to find out, okay, this is a follicular thyroid cancer or papillary thyroid cancer or anaplastic thyroid cancer. And they're going to see, how much area is covered. And they're going to say stage 1, stage 2, something like that. And then they'll be able to say, okay, what's the best treatment now for this? Most of the time, you would say, okay, you could do something with radioactive iodine, where it's kind of cool because they give you some iodine that only gets taken up by the cancer cells and the thyroid cells in that area, and it destroys them. So it's kind of like it's a very targeted local damage, if you will. Some cases, surgery. Other cases, they may be able to do like a thyroid hormone, which may help. They could do external radiation, so like to shoot in like an X-ray beam or radiation beam at you. Sometimes chemotherapy, or you could even inject alcohol into the cancer to destroy the cancer cells. So those would be the more common things. For a lot of people, sometimes just simply if they catch the thyroid cancer early enough, they may just need a surgical procedure and don't need a whole lot more than that in order to get sort of, catch it all. So that's the idea about, being monitored and taking action decisively. It'd just be less work and hassle later on.
You mentioned stages. So are there stages in thyroid cancer, like stage 1, stage 3, stage 4, et cetera, just like with lung cancer and other things?
Yeah, so any cancer could be staged from 0 to 4. And, basically 0 is just barely there. 1, it's still in the tissue. 2 and 3, it's starting to grow outside the local area. And then 4, it's spreading throughout the body, or at least starting to spread around the body. So the higher the stage, the greater the severity of the cancer or the threat to your health.
So we're talking with Dr. Tom. This is Ask Dr. Tom, and you can get this and other episodes of Ask Dr. Tom audio on iTunes. You just go to iTunes and look for Ask Dr. Tom, or any place where you like to download your podcast. What we're doing today is we're taping multiple episodes, and so if you have a question for Dr. Tom for future, coming up, I'll tell you how you can get your questions in. Today's episode is about thyroid cancer, and we talked about how it's normally treated. Can thyroid cancer be treated without chemotherapy and radiation?
Yeah, so just some of the examples would be surgery, thyroid hormone therapy, radioactive iodine, targeted drug therapy, injecting alcohol into cancers. And there's also reports about using selenium either as a supplement or in the form of Brazil nuts, or even like baker's yeast as a supplement form. You have different, like the type of yeast you would use for cooking, like making bread rise, that kind of yeast. So those are different natural sources of selenium. And selenium is important for making thyroid hormones and helping fight some of the inflammation at thyroid gland. So they've actually looked at adding selenium to these different other therapies to enhance outcomes. And overall, the data seems to be pretty favorable to that as a strategy.
Is radioactive iodine not radiation?
Well, it's I guess you might say it's a form of radiation, but normally when you think of radiation therapy, you're thinking of like this beam that's being focused on you. You're not thinking about like some seeds that are input into you and then slowly releasing something, So it depends on how you're categorizing it, but radioactive iodine is looked at differently than radiation therapy.
I see. And so then, are there natural hormonal treatments for thyroid cancer? And if so, what are the best in your view?
So I spent some time looking up, it's common for a lot of alternative medicine centers to do things like Armor Thyroid and iThyroid and all these other versions to see, about treating thyroid cancer. I haven't found any published research on that. So in terms of what's published and proven, nothing there. I then took a look at like what's been out there that's actually being investigated. Most of the research is cell studies and animal studies. So studies on actual humans, there's not many. What is interesting is there's a compound from cruciferous vegetables called sulforaphane, and that's been used to fight against cancer with light therapy. So basically, you have sulforaphane and light therapy, and it's been shown to be effective against cervical cancer, lung cancer, and certain forms of thyroid cancer. There's also some recent investigations being done into genistein, which is like a soy phytoestrogen, hypericin, which is an active ingredient from St. John's wort, then curcumin, which is basically from turmeric, resveratrol, which is from grape skins, and you hear about a lot of times with red wine like Pinot Noir, and you have EGCG, which is epi-gallocatechin gallate, which is basically the green tea component. So there are some natural substances right now that are being investigated for the application to treat thyroid cancer. However, they don't have like the robust clinical trials, because these companies don't have the funding like a drug company does. So if any center was going to use them, then you just got to make sure you're monitoring a patient to see if they're working and not. What I see sometimes, though, is people will read a study on cells and they'll just start taking all these pills. And those pills may actually counter what they're trying to do with, say radiation or chemotherapy. And the thing is, you got to be able to have all your puzzle pieces lined up, right? And sometimes if they're not lined up and they don't fit well, one treatment or therapy may be canceling out something else. So it's, that's where I think it makes sense for people to go to Causenta, where we actually have expertise in all these areas. And we could say, look, we're not going to do curcumin, and here's why. Because we have data saying it didn't help. Or we're going to do genistein, and here's why, because we have data showing it improved the result. And that's different than the way most people are trying it. They're just winging it based on something they read on the internet.
How does Causenta help patients suffering or how can Causenta help patients suffering from thyroid cancer?
Well, a lot of ways. One of them is just looking over the medical records that have already been done to say, wait a minute, there's a bunch of stuff here that's been missed. Here's some follow-up tests that could help provide good details to make a better decision as to which type of treatments to go. And then we would make sure the patient knows all the options. And then depending on what resonates with them, we don't force people to do one treatment or another. Most people kind of have a sort of a feeling of where they want to start. And then depending on where they want to start, we'll do everything we can to make that successful. But we've done things now. We've supported people around surgical procedures. We've supported people around radiation procedures for the thyroid gland. We've had people not do anything at all. That's not normally my first recommendation, because I think there's certain results like surgery and some of the other treatments that we mentioned earlier. There's lots of data showing it works with minimal risk to the patient long term. So it's a better fit, I would say, for most people. But we do get people that are so afraid of surgery because in their mind they read somewhere that surgery makes cancer spread, that they refuse to try it. So then we'll create something that, resonates with them in a positive way and helps them beat that cancer.
Well, I've heard you mention this concept before, this idea that people have a perception that surgery makes cancer spread. And I think that I've also heard it, and I don't know if it was in the movies, but I believe it was a concept or a belief that was, at least in the way that I was exposed to it, from either like Mexican families in Mexico or Hispanic families, where they believe vehemently that you never do that, because the minute you do that, like the air gets in there or something, and then people are having cancer spread because they had surgery. Is there any truth to any of that, or is it just complete fear and sort of rumor mill stuff?
Yeah, so there's some basis to it, but it's kind of like taking a fact and converting it into misinformation. And so it's like this. Years ago, when let's say they were doing like a needle biopsy or a puncture or something. So let's say you have a tumor somewhere in your body. It doesn't matter if it's your breast, your prostate, your colon, and lung. And let's just say somehow doctors getting a biopsy needle into that tumor to collect the sample so that they could send to the pathology lab. So the concern is the needle goes through the tumor. The tumor is like an encased, it's got a barrier around it, if you will. As the needle goes through the barrier, it now puts a hole in it. And as a tool comes out, there may be some cancer cells or some cancerous material gets pulled through and now introduced into the blood supply. And that maybe that can contribute to metastasis of spreading of the cancer. So let's just assume that was true. Let's just say it's true. It ignores the fact that the tumor is already producing cancer stem cells that are getting in circulation, right? So that's happening whether you did a biopsy or not. So the real question is, does the biopsy make it worse, or does it, cause metastasis at a faster rate? You already have cells getting in circulation. So that doesn't, that's already happening. So it's a moot point about that process because it's there whether you did the biopsy or not. A lot of the times, the way facts are represented in a way, there's like a fear-based angle. And so what happens sometimes is people are told, oh, you're spreading cancer from the biopsy. What they're not told is, well, some of the cells that get spread, they die off. So there's no real threat to you. So there's lots of labs now offering that they're going to test cancer stem cells, but no one's really showed what that means yet. And so there's all these claims like, oh, we're going to tell you if you have cancer cells in circulation. Well, that's not really important. What you really want to know, of those cells, which of them are going to grow and form a new tumor. Some of those cells are going to die off. You don't care about those cells at all because your body is going to kill them, or the cancer cells just are too fragile. They're not going to survive outside the tumor environment. So that's like worried about something that doesn't require any time from you to even think about. Now, as far as, another aspect about that, if you're doing an appropriate therapy, you actually want to break the barrier of the tumor. You want whatever treatment or therapy you're doing to get inside the tumor and kill the cancer cells. So there's lots of treatment approaches where the whole basis for success is they use heat, or they use a needle, or they use cold to basically break through the tumor barrier and disrupt the microenvironment of that tumor. So, some of the fears around the biopsy needle and stuff like that, one, I would say every oncologist I ever spoke to is educated about this. I've never met an oncologist or even a general surgeon that doesn't know about some of these concerns. They're aware of it. They look at the risks and the pros and the cons, and they consider all that as part of what they do. And they have far more expertise than a web page on the internet for the most part. So I think it requires people to look at the whole story, the whole picture, not just part of it. We've had lots of women, particularly with breast cancer, say, I don't want a biopsy. And then it's like, well, how do you know what kind of cancer you have? It's in your chest, but what form of breast cancer is it? Is it estrogen receptor positive? Is it estrogen receptor negative, and so forth? There's all these different details. And these are examples of fear, blinding people to a healthy way of making the right choice or decision. What you always want is get all your data, get all your facts, and then make a decision. But sometimes out of fear, people are, running in a direction without even knowing if that will even help them.
One last question before we wrap up this episode of Ask Dr. Tom. It's thyroid cancer, and you can get your questions in for other episodes of Ask Dr. Tom at askdrtom.com. Spell out the word doctor, askdrtom.com. You just mentioned the stages. And stages in cancer in general, and we hear things like stage 3 or stage 4, and stage 4 sounds, oh man, here we go. So it is, if you have cancer in your thyroid, is that, and it's just in your thyroid, like in a nodule or something, is that stage 1? And then the second part of that question would be if you have, I read in some of these statistics that 50% of the time that is, they will also find cancer in the lymph nodes near the thyroid. And does that make it stage 2 or 3 or does that make it stage 4? Obviously, it's specific to a specific case, but just generally speaking.
So in terms of this cancer in thyroid and has not spread anywhere else, let's just say 1 or 2, if it's spread into the lymphatic, like say a nearby lymph node, you're looking at 3. If it's gone beyond the lymph node to the rest of the body, you're looking at 4.
Yeah.
So those are kind of like the very simple ways of looking at it. An oncologist will do further detailing or staging. They may go like a 3A, 3B, that kind of thing. What the patient should find out is, okay, is it local or did it spread? Because that's important, because that kind of gives you a sense of how long has this been going on. Like if you just find a bump and you go get it checked and it's not anywhere other than that one spot, then that's a better situation than if it's now spread and it's in other parts of your body.
And how would they know if it's in other parts? If they go in and they take it out in the thyroid, and then there's they'll take the lymph nodes out just to test them, and then they find it in the lymph nodes. How will they know if it's anywhere else? Is there such a thing as like a whole body scan? Is that what a PET scan is?
So the way it kind of progresses is, let's say you had an ultrasound and you see some nodules locally. Then at a certain point you follow up with MRI, and then you're going to see there's some like more area. You're going to get some better detail. And then when the surgeon or the surgical pathologist or whoever's getting the biopsy, when they get their sample, they're going to get some data. And then from that, they're going to say, hey, this looks like it's spreading, and let's follow up with, usually you don't do a whole body scan, but you might do something like a PET scan from your head to your knees, just to see what's showing up there, because it's very rare to have anything below the knee. It's not like 0, but it's just so uncommon that usually you don't get a PET scan that far down, unless you're just suspecting like a sarcoma or an osteosarcoma or something like that. And so then from that PET scan, you get, usually it's what they call a PET-CT hybrid. And what that means is the PET scan is going to tell you what is basically cancer activity around the body. The CT scan will tell you the structure. So between the two, you get good details of the structure and you get good activity, and that helps you to understand some things. And there's times when sometimes people have a mold infection and it shows up as a tumor. And so then, you do even further follow up to see, what does it take to eliminate that? And then if it's a mold and you treat it with antifungal and disappears, you'll know then, okay, that was a fungus infection and not something else.
So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to Causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.